Greetings. What is the cost of IVF in Nigeria? What is the cost of IVF in Nigeria? Before I continue, right, I want to plead with you to please subscribe to my YouTube channel. The name of my YouTube channel is Nigerian Health TV, and you can subscribe using the link in my bio. And the Nigerian Health TV is just right in your screen. Thank you. Now, back to the topic. What is the cost of IVF in Nigeria? I'm going to explain it to you in terms that you understand. Because the cost of IVF in Nigeria or any part of the world is not clear cut because there are many factors that determine the cost. One of which is the age, the number of cycles you need, right? The hospital you are using, the location, right? The cost of drugs, fertility drugs you will take. The another thing is the number of tests you will do, right? And follow up, right? And also how you will deliver is also factored in, right? And those are the factors those are the things that determine the cost of IVF in Nigeria. Now, I know many things about IVF, especially as regards the logistics. I know a lot of things about IVF. You'll be surprised. I've worked with many consultants that are IVF experts. I've worked with pioneers of IVF and I've even interviewed them. I've written several articles about IVF, especially as regards the costs in the past. I once wrote an article in 2017 about the cost of IVF where I explained a lot of things. Now, to the determining factors of IVF. One is the age. The older you are as a woman, the lesser your chances or the more difficult it is for you to get pregnant, the more procedures that will be done for you to get pregnant during IVF. So the more money you will pay, right? That one is clear. You are going to pay more if you are older. If you are an older woman, most likely you are not ovulating, right? And your partner is older, the sperm is not that viable. That means you are going to need sperm donors. You are going to need egg donors. And that adds to the extra cost, right? That adds to the extra cost you pay. In fact, for sperm donors, they are paid 250,000 naira averagely. Egg donors collect as close as 1.5 million naira averagely. So add that to your cost. So if you were told that your IVF cost is going to be 2.5 million and you are already paying egg donors and sperm donors, that means your IVF cost is going to rise up to like 5 million naira. You understand? Compared to a woman that does not need egg donors or sperm donors. So that is that. Number two, the number of cycles. For some hospitals, they will not allow you do one cycle. Some people will tell you that they paid 1.5 million naira to do IVF. They paid only for one cycle, right? They paid only for one cycle. Some hospital will tell you that you need to pay for 3 cycles for a start, right? You need to pay for 3 cycles for a start. So, and if you pay 1.5 million for one cycle, multiply it by 3. That is 4.5, right? That is around 4.5 million naira. You're already paying for the IVF. So the number of cycles matters a lot. And let me also tell you one thing. If some hospitals do what they call embryo freezing, they will fertilize the egg. After the IVF, the eggs are fertilized. The embryos that is formed, they will freeze it for you. And you'll be paying for that. There are some people that pay for embryo freezing every 6 months, every 3 months. And that adds to your cost. Because after you have taken in through IVF, you still have some embryos, let me say in the lab or in the fridge, that after you have taken in and you have delivered, your babies are grown enough, like 1 year, 2 years, you will use that embryo. You may have embryo that they will insert into you again, inseminate into you again for you to get pregnant again. You understand? And another thing that determines cost of IVF is what you want. It's not all women that go for IVF that were unable to conceive. Some women go for IVF because they want to have twins. Some go for IVF because they want to have a particular gender. Some want to have a boy child. Some want to have a girl child. If you are going for such procedure, know that you are going to pay more because it requires more, it's more technical and requires more advanced procedures like sperm washing, whereby a sperm that is viable, that a male sperm is used to fertilize your egg so that you have a male child, or a female sperm is identified and used. So you pay more because the procedures is more advanced. You pay more than somebody that just want to conceive through IVF and have a child through IVF. That is that. Another thing that adds to the cost of IVF is the cost of drugs. drugs like letrozole, metformin, clomid, fertility drugs like folic acid and the rest, omega-3 fatty acids and the rest that they give to you add to the cost. The good thing about this is that if you are on NHIS, National Health Insurance Scheme, they cover for these drugs and even some of these investigations. So if you are on NHIS and you make sure that you go to any of these private fertility centers that honor that have NHIS, so that you can NHIS can help you cover some costs. I'm not saying that NHIS covers IVF. Oh. I'm not saying NHIS covers IVF, but NHIS will cover some of your tests and some of your drugs. So it will help cut your costs. I'm just advising you. I'm talking generally about the cost of IVF in Nigeria and generally about the cost of IVF. So these are some of the things you should know. Now, the cost of investigation. You'll be doing serial ultrasound scan. You'll be doing follicular tracking. If you are not the one doing it, your egg donor, your sperm donor, your egg donor will be doing them. Well, that already, the 1.5 million naira you are going to pay your sperm donor, you are going to pay your sperm donor already covers that. And most time, if you want to cut cost, your egg donor and your sperm donor, they can be family members or friends, right? You can look for somebody for the hospital, but most time the hospital want to have their own egg donor. They have their own egg donors, they have their own sperm donors that they call them. But if the hospital allow you to bring a egg donor, sometimes you want to have an IVF and you want the donors to be from your family, is accepted. You can call your family member and that will reduce the cost for you. So have that in the back of your mind. You can call family, but it's not all hospitals that allow that. So the hospital can tell you no. They have their reason. It's their policy. You don't need to be arguing with them, right? Thank you. Now, the cost of tests. I've mentioned you will do serial scan. You'll be doing follicular tracking. You'll be doing blood tests, hormone profile. They'll be checking your hormone level. Do thyroid function tests. Will check your thyroid level. You understand? They'll check your kidney, do your blood sugar. Those tests add to the cost of IVF, right? They add to the cost of IVF. So the good thing is that NHIS cover most of those blood tests during IVF. So you have nothing to worry about if you're on NHIS. Just go to the center that is approved by NHIS, that have NHIS approval. So that is that. Another thing that add to the cost of IVF is location. IVF done in Lagos, Abuja, and Port Harcourt is more expensive than IVF done in places like Benin City, even with high success rates. So there's high success rate of IVF in Benin. There's high success rate of IVF in Warri, Lily Hospital in Warri. There's high success rate. There are other hospitals in Benin, in Enugu, in Anambra, in Port Harcourt. Yes, but the IVF done in Abuja, Lagos, and Port Harcourt is quite more expensive than those done in other hospitals. Then the type of hospital you are using, right? The type of hospital you are using. Some hospitals are more expensive than the others, right? Some hospitals are more expensive than the others. And if you go to such hospital, you are going to pay more compared to people that went to other hospitals, even though the success rate is high. Success rate of IVF in Nigeria is very high. So that is that about IVF. Also, if you have some medical conditions like diabetes, hypertension, that means if you take in, you are going to require more follow-up, more careful follow-up. That means you will pay more. Women that have fibroid during pregnancy, yes, they will pay more because they require more follow-up, especially when it comes to that red degeneration. Sometimes you will not be able to conceive yourself. Somebody may help you to conceive. It's also part of the whole IVF scheme called surrogacy. You have to pay the surrogate mother, right? And it is the hospital that will recruit the surrogate mother for you. That's it. So this all add to IVF costs in Nigeria or anywhere in the world. Age, drugs, cost of drugs, your whether you need sperm donor, egg donors, the hospital you are using, the number of cycles you want, they all contribute to the cost of IVF. Medical conditions and the location where you are doing it also all contribute to IVF. The good thing is that NHIS covers some part of IVF, so use your NHIS if you are on NHIS. I've come to the end of this video. Before I go, I want to beg you again to please subscribe to my YouTube channel. Nigeria Health TV is my YouTube channel. It's right on your screen. Thank you and bye-bye.